Welcome to today's episode of the Hub Podcast, where we chat with VolunteerHub clients about their experience with our volunteer management software and the impact they're making within their communities. I'm your host, Eric Berger, Director of Marketing for Better Good, the maker of VolunteerHub. Today, I am thrilled to be joined by Samantha Lassey, Volunteer Engagement Coordinator for Partners for World Health. Partners for World Health is a pro-level VolunteerHub client that collects medical equipment and supplies and distributes them to communities in need. Hey Samantha, welcome to the show. How are you today?
Doing well. How are you?
I'm good. Thank you so much for taking the time to talk to me today. I know it's busy at nonprofits, so thanks for carving out some time to chat with me.
Oh, absolutely. I'm excited to chat.
Great. So to kick things off, I would love to learn more about your role at Partners for World Health, what your typical day looks like. Do you mind describing it to us?
Sure. So I am the volunteer engagement coordinator at Partners. I started here back in November, so I've been here for about 5 months now, and it is definitely a learning curve every single day. So I guess in terms of main typical things that I do, making sure that everybody's signing up on VolunteerHub, helping to answer any questions for folks who might have issues getting online, that sort of thing. I am working to coordinate volunteer groups, getting the sign up pages ready for them as well. Just working really hands on with our volunteers. I do the orientation sessions for all of our new volunteers, whether that is a general orientation for anyone who's interested to come and volunteer with our organization, or if that's an individual orientation for a group that we might be having in that day. So pretty much just making sure that things with the volunteers are moving smoothly, making sure that we have groups coming in and coordinating with the other people on my team to make sure that we have tasks set up for them, that sort of thing. General operational tasks like taking in donations, doing the autoclave, that sort of thing as well. It's definitely a miscellaneous assortment of tasks that I do throughout the day, but they all work together towards the same goal.
Thank you so much for providing those insights. So if we step back a little bit, can you tell me more about Partners for World Health, your mission and vision there?
Yeah, absolutely. So Partners for World Health is a nonprofit organization that was founded back in 2009. Our mission is to help others lead healthy lives on a healthy planet. So when I'm doing the orientation sessions for folks, I always like to explain our mission in sort of a twofold manner. So on one hand, we are working to limit medical waste by diverting it away from the landfills, which is where it would go if it didn't come through our doors. And then on the other hand, we're working to provide access to healthcare that other folks wouldn't have, whether that is because they're in a developing country or they're experiencing some sort of conflict or crisis. That is sort of our mission in a nutshell. To go back to the medical waste portion of things, I think this is an issue that not a lot of folks are really aware of. I certainly was not aware of this issue before I started working here, but there is a ton of medical waste that is generated here in the US. And that is mostly because anytime that you go to the doctor or a hospital or wherever, anything that comes in that patient room with you has to be thrown away. And so we're trying to address that problem and just the insurmountable amount of medical waste that is generated every single day in our country. We're trying to tackle that while also trying to provide those supplies to folks that can actually use it.
And you also have 5 core pillars at Partners for Health. Do you mind talking about those?
Yeah, so first pillar that we identify is our global health pillar. So this one directly goes with our container shipment program. So these are those 40-foot containers that you see on the highway. We fill these with medical supplies and send them out to facilities or organizations that are requesting them. So facility or an organization will reach out on behalf of a facility requesting medical supplies. We send them a pro forma list, which is just an inventory of everything that we have here. And then they sort of send it back checked off with what they would like to get in their shipment, essentially. And so once we determine the types of equipment and supplies that would be appropriate for whichever facility we are sending to, we start to pull all of those supplies together. And all of that is done by volunteers. So they are the ones who actually pack the boxes that we send out. They get all of the stuff ready for shipment. They actually help us to pack the containers themselves. So that is the global health pillar. Local health pillar has to do with our medical supply purchase program. So we get in donations of durable medical equipment. So that's anything from crutches to walkers to wheelchairs to hospital beds. And so this type of stuff we take in, we clean it up. If it needs to be fixed, we will fix it. And then we sell it back to the local community here in Portland at about 80 to 90% off the retail price. So for example, a pair of crutches can run you about $40 from Walmart. You can get them from us for about $7. So there's a huge reduction in the price there. And we have sold this equipment at a reduced price to over 800 Mainers in 2024. So it's a great program, and about 80% of the stuff that we sell through the program gets donated back to us. So that's a great segue into our environmental pillar, which is what I mentioned earlier, trying to divert these supplies away from the landfill and instead put them into the hands of those who need it. So we work with over 150 healthcare facilities in New England to reduce medical waste by taking in their surplus supplies that would otherwise be discarded and sent out to landfills. So that is our environmental side of things, where we're trying to reduce medical waste as much as possible by turning it into something that is not waste, something that is usable and very helpful for other folks. And then we have our humanitarian pillar, which kind of coincides with our global health pillar. This sort of references our medical service trips, where we provide education and training on how to use some of the supplies that we send, as well as providing hands-on care to the local patients in the areas that we serve. So a great example of this would be our Project 10,000 initiative. This is our initiative to reduce maternal and infant mortality rates in sub-Saharan Africa. So whenever we go on a medical service trip to sub-Saharan African countries, we bring with us birthing kits that have anything and everything that pregnant mothers need to deliver their child safely. And so we distribute these out to pregnant women in the community that we serve, in addition to providing them education about when to seek help for the complications of pregnancy. So that's just an example of our humanitarian efforts. And then the final pillar is our education pillar, which also kind of goes hand in hand with our humanitarian and global health pillars, as we are providing the education and training to local providers on our medical service trips about how to actually use the supplies that we are bringing and sending to them. And additionally, just educating the general public about the issue that is medical waste and the things that can be done to solve it, and the ways in which that it impacts not only our environment, but also healthcare costs here at home.
So you guys are doing amazing work all over the place.
Thank you. Yeah, you could say that for sure.
When you think about your organization's impact, are there any metrics that stand out to you?
We've sent 29 shipments since January of 2024. And that's a record-breaking year for us for sending that many containers. Like I mentioned, those are those 40-foot containers. So I believe in the first year of our founding, we only sent maybe one or two. But so now we're up to 29, which is really, really great. Since 2010, when the first container went out, we have sent 150 shipments. So since 2010, that's about 15 years now, we've sent 150 shipments, and we have saved over 3 million pounds worth of medical supplies and equipment. So going back to just the 2024 statistics, in those 29 shipments, we've totaled about $7.36 million worth of medical supplies and equipment. 12 of those 29 shipments were emergency response shipments, including to Ukraine and to Gaza. And additionally, we have sent a total of 16 container shipments to Ukraine since the beginning of the war in 2022.
Wow. So let's shift gears a little bit and talk about volunteers. How many volunteers does your organization engage annually, and what would the consequences be if you couldn't effectively manage them?
So we have roughly 140 volunteers that come in to volunteer on a regular weekly basis, whether that's once a week or some even come 4 or 5 times a week. We have 150 regulars, is what we call them. And then we have about 1,500 volunteers registered in our VolunteerHub system. So not all of those are coming in on a regular basis, obviously, but many of them are coming in at least once a quarter, and they are receiving all of our communications and coming to our events and that sort of thing. In 2024, we had 41,555 volunteer hours, which we have found is roughly equivalent to about 20 full-time positions. So as a nonprofit organization, being able to have the equivalent of 20 people doing a full-time job done by volunteers is very, very helpful. And additionally, it's very important for us to be able to track these hours for grant funding. So if we weren't able to effectively manage our volunteers, not only would the operational area of our organization suffer, so would the advancement department and fundraising efforts. So pretty much everything in our organization stems from our volunteers. So being able to keep track of them, being able to make sure we have tasks ready for them is very, very important. And like I mentioned, the work that they put in is equivalent to about 20 full-time positions. So they're doing really, really hard work. And without them, we would not be able to do what we do as an organization by any means.
That's really amazing to hear that you're getting that much value from your volunteers. I'm curious, what kind of roles do volunteers fill within your organization?
Sure. So volunteers really have the opportunity to sort of, I guess you could say, create your own adventure when it comes to volunteering at Partners. We have many different ways for folks to get involved. A typical shift for someone who might be coming in for their first time, we might set up a table for them where we have a specific task designated that has come from a specific category that we have in our warehouse. So the way that we organize our warehouse is that we have different medical categories that are managed by quote unquote a category owner who is a volunteer who knows something about the medical category that they're working in. So when they identify an issue with something that might be in their category, they send it back out to us on the main floor to fix the problem, essentially. So if it needs to be repackaged, they'll send it out to us and say, repackage this. And then we set up on a table to have it repackaged. So sorting, repackaging, reprocessing, labeling, that sort of thing is a very typical volunteer task. I mentioned that we have category owners as well. That's a very important volunteer task as well. They are pretty much in charge of managing each medical category in the warehouse. They're in charge of micro sorting, which will make more sense when I explain macro sorting next. And they are also in charge of boxing up things for their shipments as well within their own categories. And so to go to macro sorting, which will make the micro sorting make a little bit more sense, that is arguably one of the most important jobs that we have here for volunteers. All of our incoming donations are sorted through by volunteers. We have 7 warehouses and only one of them actually takes in and processes donations. So all of our donations that we take in will come through the doors of our processing warehouse, which is where we house all of our volunteers. So our macro sorters actually sort through each incoming donation and they sort it into the appropriate category, which is then brought to the category owner, which is then sorted through again within that category. And then, like I mentioned, if there are issues that arise, sent out to the main floor for the general volunteers to take care of. So I realize now I probably should have explained that backwards than how I did it, but that's pretty much how things work. It goes through macro sorting first, which is done by volunteers. Then the category owners do their own micro sorting. And then the general sorting and processing happens out on the main floor from those categories. Also have volunteers who drive the vans for us. So they help us to pick up donations from places that are farther away. They help us to get things from one warehouse to another. And they also help us to rearrange stuff that we have in the warehouse. We also have a sewing group that works on many different projects that we have. So for example, we have a partnership with a hotel locally, and they donate their linens to us every couple of months. And then our sewers actually sew those into hospital size sheets. So there's really a volunteer task for everyone. We always like to tell folks that if there's something that you would rather do or something you'd rather not do, that we will always accommodate them because, like I mentioned, there are so many different tasks and so many different things to do in our organization for the volunteers.
And so to manage volunteers, if we shift a little bit now to VolunteerHub and your experience with the software, how has your experience been learning VolunteerHub and what inefficiencies do you believe that VolunteerHub solves?
Starting with the first portion of your question, just about learning how to use VolunteerHub, I found that it was very user-friendly, very easy to get myself going and learn how to use. I would say one obstacle that I had was I think there may have been a misunderstanding when it was originally set up just about event groups versus user groups. So that's really the only kind of obstacle that I ran into, but the support team was very, very helpful in helping me to organize that and get back on the right track with things. But in terms of actual inefficiencies pre-VolunteerHub, I spoke with my supervisor because he was sort of on board before we made the switch. And he said that before VolunteerHub was implemented here at Partners, all of the hour tracking was done on paper with a sign in and sign out sheet that required remembering and accurate reporting both of which were very difficult and resulted in severely underreporting our tracked volunteer hours prior to coming on board with VolunteerHub. So right off the bat, the biggest inefficiency that VolunteerHub helped us to solve was the volunteer tracking. It's just been so helpful in terms of actually having some sort of accurate record of volunteer hours. And additionally, it allows us not to scramble to get volunteer tasks set up for folks. My supervisor told me that before VolunteerHub was implemented here, it was pretty much just kind of a walk-in thing for volunteers to come. They could come in when they wanted, and there was really no sort of structure for when people were coming in, who was signing up for what day. So it was pretty much you would get there and you would learn as the day went on who was coming in. So you'd sort of have to scramble to get a task ready for them. But now, since we have VolunteerHub, we can see in advance who's signed up so that the night before we can get everything set up for everybody so that when we come in the next morning, all the tasks are ready to go. So that's another major efficiency thing that VolunteerHub has helped us with.
Do you mind providing a little more context around your experience with our support and implementation team?
They've been very helpful to me. I mentioned there was sort of an obstacle with the user groups and event groups in terms of how we understood them to work here at Partners. But after meeting with Matt and having an optimization session, it was very clear what the intention was for those two features. He helped me to be able to use them more effectively and efficiently as they were intended, as well as giving me other advice and just helping me out with other issues that I have run into.
Looking at your investment in VolunteerHub, how would you assess it from an ROI standpoint?
I would say definitely, absolutely worth the investment, 100%. Volunteers do almost everything here at Partners. I mentioned earlier, their work is equivalent to about 20 full-time positions, and we only have about 15 or 16 full-time staff here at Partners. So obviously they do a ton of the work that is done here. We estimate about 90 to 95% of all of our operations are done by volunteers. So definitely the biggest investment is being able to accurately track their hours for grant funding. Because where we're an organization that leans so heavily on volunteer support, it is very important for us to actually have the data to back that up so that we can get grant funding. And additionally, it's also made it very easy to designate volunteers to different tasks, if that makes sense. So if we have a specific project in mind, we can look at someone's VolunteerHub profile, or we can run a report to see, does anybody have a marketing background or something to that effect, so that we can really optimize the relationships that we have with our volunteers so that we're able to give them more specific projects based on their interests or backgrounds or what have you, whatever they've filled out on their volunteer profile. And additionally, going back to what I said about being able to plan for the volunteers, that has just really been super helpful for us in terms of streamlining our operations and making sure that we have things to do for everyone when they come in. So I would say absolutely 100% worth the investment.
I love to hear that VolunteerHub is working out for your organization, but I'd also like to know, how do you see VolunteerHub evolving with your organization's needs in the future? Do you have any long-term goals for the use of the software?
I'd like to implement kiosks at some point. We are not currently using the kiosk feature, but we are looking to implement them very soon. We think that it will help us to improve volunteer tracking even more than we already have. So that's another long-term goal that we have. Eventually, we would also like to merge our medical service trips from the service that we're using currently to organize all of that data. We would like to merge it onto VolunteerHub eventually as well. So just sort of looking ahead to different ways that we can use VolunteerHub, and definitely interested to dive in and see more capabilities as I learn more about the software, learning more about what it has to offer to us.
So my last question is, how has VolunteerHub improved your volunteers' experience? Can you provide some details about that?
So I may have mentioned this at the beginning, but we require all of our volunteers to attend an orientation session before their first shift. So this is pretty much just an information session about who we are as an organization, why we do what we do, essentially. giving folks an opportunity to answer questions or ask questions, giving them a tour of our facility, and sort of just giving them a general overview of what we do and why we do it. So having VolunteerHub as a way for folks to sign up for these orientations has made new volunteers, made the process for them to come on board way easier. I'm not exactly sure what the process was before VolunteerHub, if any. I would imagine it was sort of like a walk-in basis sort of thing that I described earlier with the general volunteers. But now we have a spot right on our main website where folks who are interested in volunteering can go straight to that part of our website. It'll bring them straight to VolunteerHub where they can sign up for all of the orientation sessions that we have listed. So it's made it very easy for folks to be able to get involved without having to reach out to us first. So previously they would have to, make a phone call to get involved. And now they can just go on their computer and go on our website and do it straight from there without actually having to contact anybody. So it makes things a lot easier for them. So they're not waiting for us to get a phone call back. It makes things easier for us too, because we're not at our desks very often throughout the day. So phone tag is definitely a huge thing here. So being able to avoid that and having just a very straight to the point way for folks to sign up is very, very helpful. A local newspaper recently ran an article on us, and the orientation following the publication of that article was our most highly attended orientation that I've seen and that my supervisor had seen within the past year. And it was because of VolunteerHub that these folks were able to just go online after seeing the article, click volunteer, and then sign up for whichever orientation they'd like to.
It really is amazing how much of your program is impacted when you have a better process for managing volunteers. Samantha, thank you so much for taking the time to talk to me about your experience with VolunteerHub and for talking to me about Partners for World Health. I really appreciate you carving out the time.
It was a pleasure to chat with you, and thank you so much for having me on the podcast. I'm very happy to chat about VolunteerHub and my experience with partners. It's been great. So thank you.